Very good morning to one hour present. Basically, I am going to present a paper on a hybrid approach of image segmentation for medical MR images using SMACM and genetic algorithm. Basically, this is a hybrid concept using genetic algorithm for optimization purposes and population generation. We have to find out spatial multiple kernel for this image algorithm. Before that, I will give the overview. What do you mean by images? Basically, the optical appearance of anything in front of a mirror is called an image. And basically, this is nothing but a two-dimensional array of elements which will be formed in the form of a matrix. And basically, if you want to show the mathematics form of the image, it is nothing but a array of elements that is in the form of a 64 into 64, 128 to 120, 252 into 250, row as well as column. If you identify something, then we have to analyze it and individual elements, that is called smallest element of an image, that is called pixel. Pixel is the smallest element of an image. And here we have to go for a medical application or healthcare sector application by using this MR imaging. And if we have a disease, we have to consult with a doctor. Then doctor will be depend upon our requirement, our health problem. Doctor will be go for testing. Either it may be go for X-ray or CT scan or MRI. Or at present PET scan was available. Okay, by seeing this X-ray or analyzing this X-ray and CT scan and MRI, then you will identify this is the problem behind it. And your intention will be you have to take that medicine or treatment accordingly. But some drawback was there for visualization each and individual person. Suppose in a hospital, thousands of people are coming for CT scan or MRI. That is very difficult to track a particular doctor to physically analyze the problem each and individual for. That's why we have to develop a software. Automatically, you will count out the problem and give the solution at instant of time. Quickly, an instant solution will be arises. Here, what happens? I have taken from the very beginning a lot of concepts were there. Just like first of all, I will explain image segmentation. Basically, image segmentation refers to the process of partitioning an image into different regions of interest, used to locate an object at boundaries. Suppose we have rare images, then we have to track what are the essential of that particular standard images and normal images, and there will be some abnormal images. Then we have to find out how many clusters it may be arises. Then find out what about the center location for that. In this case, we have to analyze the segmentation of medical images for the diagnosis and the therapy of diseases. And standard algorithm for or utmost application oriented algorithm is for this image algorithm, most popular algorithm. But there will be some drawbacks under that. And if it will be not affected by the help of noise environment, if this environment is full of noise, there will be some defect either in the manner of camera or in the form of environment. That's why we are not getting the clarity in the pictorial manner or track out the particular solution for the noise environment. That's why what we have to do, we have to go for this multiple kernel for this image algorithm. And there will be a concept of multiple kernel. What is kernel? Basically, kernel is nothing but your a window. It may be 3 by 3 or 4 by 4. I have used 3 by 3 kernel. That's called Gaussian kernel. Okay? Why Gaussian. I have taken Gaussian kernel. And here what happened? To avoid this noisy environment, Gaussian will be better as compared to your generalized mass you have or kernel you have. Then some of the spatial information will be added, and another advantage will be there. Basically, this Gaussian kernel is a low pass filter. What is the concept of low pass? It is passes low frequency and attenuates the high frequency. And basically, in the MR images or medical images, the noise will be in the high frequency region. If you discard the noise in the high frequency region, then the solution will be better as compared to your low pass region. That's why we have to utilize low pass filter here, that is called Gaussian kernel. And here what happened? We have to compare object to object, because a lot of objects were there. We have to find out what about the spatial information, what about the nearby information. Then we have to, for optimization purpose, we have to utilize genetic algorithm for this solution point of view. Then those are the papers. Basically, latest paper 2021 15. Those are this is my paper. I have utilized multiple kernel only, but in this paper I have added some of the genetic approaches for this minimization problem or minimum error and accuracy point of view. Then those are my references you have. My proposed research work focuses on classification of clusters of that. Basically in brain images, three carriage will be very important. That is called WM, GM and CSA. Those are the basic things required for a brain images. Or if tumor will be arise, we have to calculate what about the accuracy of WM, GM and CSA. From this accuracy, you can conclude what about the disease or what is the particular disease occurring and how the doctor will be given the precaution for that. What medicine he has to take into consideration. Then this is my analysis. What analysis we have to do? Tissue types. Those are the tissue types here. Here GM, WM and CSA. Those three are main tissue types in a particular MR images. And basically this will be available in brain MR images. And analysis of brain is very important. If you have a brain hemorrhage, then we have to first track what they to those three parameters. If those three parameters is not up to the mark, then there will be a shortfall. Okay? Then accordingly we have to take that action. Then what I have to utilize my proposed approach? I have taken MR images from the data set available, and here I have taken 18 to 16 years ages brain images. That's why then we have to go for pre-processing. Basically, in pre-processing, different enhancement concept. I have utilized histogram modeling for this enhancement. Then we have to go for detection or edge detection. We have to use that morphological edge detector for this pre-processing point of view. Along with morphological detector, some of the other processors were there. That is called Sobel, robot, Canny. Out of that, morphological edge detector is best as compared to those three. That's why I have utilized pre-processing point of view. Then we have to initialize population for that by the help of spatial multiple kernel for this image algorithm.
What is taken from the consideration for this image analysis?
Yes. Those are the properties you have. Okay. Then after that, initial population. Then this algorithm I have utilized for my 2015 paper multiple kernel. Okay, here I have utilized some of the spatial constraints along with some of the genetic algorithm concepts. Okay, that is called the mutation, crossover, selection, and termination. If it is converse, then terminate it. Then we have to find out the proper number of region. How many regions this effect will be occurring? Okay, and how to find out a region? Suppose in the digital images, 10 patches will be there. Okay, if sum of the 3 by 3 is 1, then only you can find out this is the region or a white region, gray region, CSF region. Then only you can conclude what about the proper number of region, how many number of region. If it is converse, then we have to terminate. Otherwise, we have to move in this loop. That is the concept of the genetic algorithm. Okay, but in last paper I have given directly we have to apply this SMJ fitness function. Okay, from this multiple kernel positioning algorithm. But I have added something here. Then we have to find out the region of. Then only we have to focus the segmented MR images we have, and this will include reprocessing and spatial multiple kernel positioning algorithm for fitness evaluation and the genetic algorithm for segmenting the particular images.
Sir, one question. So for the images, have you done the image segmentation marking of the images
Yes.
based on to identify which is white, which is grey, and
This one, just to see this image. I have taken this one. This is one MR image, first images. Here I have taken or added some of the noises. 6% noise level I have added. Okay, but here in this example I have added 6% noise level, and you may add 2%, 4%. I have also done it 2%, 4% noise level also. Then here, what about the WM, GM, and this one is CSM. These three images I have taken into account. We have to find out what are the particular region we have. Then after that, we have to going fast. But after 18, we are not getting saturated. That will be standardized. Brain will be there. No skill set will be developed after 18. That's why we have to compare with the medical data set. What exactly they are referring.
yeah, that's the reason I asked. Do you have
That is validated.
yeah,
That is after validated we are giving to the giving my data.
In some cases, the proposed model is increasing whenever the noise level is increasing, but KFCM and MKCF is whenever the noise percentage is increasing, the accuracy is decreasing.
Decreasing. That's why this algorithm